I'm joined this morning by almost a sort of full pack of panel members who will introduce themselves as we work through the presentation and discussion, including Susan, Jenny, Sally and Simon, who are the kind of core team working on this review. Next slide, please, Susan. Just to kind of run through the organisation of the morning, I'm going to kind of start off by giving you some introduction and background to the review, then hand over to colleagues Susan and Christine Lenihan, who will explain her role with the review in a minute as the director of the National Council for Disabled Children. And then we'll take you through the key findings. Then there'll be a Q&A, and then we'll move into breakout groups, which is always very exciting. But our experience on previous webinars is that Steve takes us through that process in a very fluid and effective way, and that will allow us to have sort of smaller group discussions about the really important issues raised. We'll have some feedback and then close probably at 10:30. Just to move on to the next slide. So there you are. You've got the pics of the 10 members of the panel. We have two people who are not with us today, Janine Davis and Isabel Trowler. So you can match up the photos with the pictures on screen as your next task. More seriously, just to say something about this review, it's been a very different kind of national review to the ones that we've hitherto undertaken, ones on criminal exploitation, non-accidental injury, and then last year child protection in England about the deaths of Arthur and Star. And it's been a different review for a number of reasons. Firstly, its focus is very specifically on a relatively small group of children whose needs are often overlooked in policy and practice discourse, overlooked in terms of attention to their specific needs, and their needs often being subsumed, we think, under the kind of broader other groups of children with SEN, children who are looked after. So that's one very critical kind of and different aspect of this review. Secondly, it's about abuse that took place in an institutional environment and has raised a range of questions and issues about the effectiveness or otherwise of the safety net that the complex safety net that we have in place that should protect children who are living away from home, away from their families. The average distance that these children were away from home was over 90 miles, and they'd been placed in these three settings by something like 60 different local authorities. And Susan and Christine will say more about that in a minute. And the other thing that's really important and is slightly different about this review is that it was initiated in very large measure because the issues that were being highlighted through a complex police local authority investigation in Doncaster had highlighted to the safeguarding partners in Doncaster the national gravity and importance of the issues, and they came to us and said, we think you should be undertaking a national review. And so that's why we initiated that review, because of the evidence that they were identifying through their complex investigation. So a really important review, and it's taken quite a long time. It's taken 18 months in 2 phases, and you'll hear more about that in time. And it was published, as you know, last week. And we were, I think, pleased by the attention that was given, that there was a recognition across the media, and it's certainly been true in terms of responses from stakeholders, including government, local authorities, health bodies, and so on, the regulators, that the issues being flagged up by what happened to these children is of supreme importance, and we absolutely must take this opportunity to deliver some really fundamental reforms in how we protect this group of children. We have been here before. People like Christine will say that with a very loud voice, and we have been here before, but we need therefore to make sure that these messages and these recommendations are taken forward. Otherwise, we will see a repetition of some of the kind of shocking experience of abuse and neglect that was suffered by children there. So in terms of the introduction and background slide there, you can see the first phase very much looked at the experiences of those 108 children who were living in the 3 homes run by the Hesley Group in the Doncaster area, 3 residential special schools. And what came out of that part of the review was how the inadequacy of the safety net and how it was activated, that safety net that should have responded to concerns and complaints over quite a significant period of time. And because of our concerns that what had happened to those children, last summer we asked all directors of children's services to complete 3 important actions in relation to quality and safety reviews of all children within this group of children who were placed in similar settings in other parts of the country. And that exercise, where there was 100% compliance, and for which we are very grateful for everybody's work, was important in terms of assuring ourselves across the system that what was happening in Hesley was not happening in other places. And so that gave us some immediate assurance, but of course what it didn't do was to kind of address the fundamental systemic problems that that phase of the review had identified, and which phase 2 has sought to kind of examine in much more depth. I'm now going to hand over to Susan to take you into the next few slides.
Okay, thanks very much, everybody. You will know that we wrote to all directors of children's services to ask them to undertake a series of urgent actions. And the 3 urgent actions were to ensure that placing authorities had an up-to-date view of the progress, care and safety. And so really grateful for people's support with doing that. Making sure that the LADO for these children had been appropriately addressed, any issues that were there, and to ensure that there was effective liaison between LADOs in their host authorities and the home authorities. But then our phase 1 report was published, and Christine, as the lead reviewer, been working with the panel, so she's going to talk us through what the findings of the phase 1 review were. Thank you, Christine.
Thank you, Susan. That's really helpful. Yeah, it's been a real honour for me working with the panel. I was very, very pleased to be asked to support this review. As Annie said, this is an area of work I'm passionate about, and unfortunately an area of work we've been in before. But this review has been absolutely key in supporting change, and the phase 1 review findings were fairly stark, really. We were very, very clear that children experienced significant harm and abuse in a range of settings, in a range of abuse, and that their voices were not heard. Most of these children were non-verbal, but all of these children could communicate. We knew that the leadership and management of the provision was inadequate, with a closed culture, and I suppose what was helpful to understand was the work that CQC had also been doing on closed cultures, and look beyond that and understand how closed cultures give rise to both poor practice and misconduct by staff. The quality of the care of the children was affected by high rates of vacancies and staff turnover. This happened during COVID, but it wasn't caused by COVID. But some of the challenges within it were exacerbated by COVID, and they were exacerbated by a turnover of staff, which meant that staff coming in were not then trained or supported, and faced with children who challenge, took poor decisions about their care. We were really worried about the impact of quality assurance across the system. It's worth remembering that there was no one agency that failed in this review. What instead we saw was a systemic failure across the piece in relation to both placing authorities and the Ofsted system, as well as everything else that went in. We also had a particular challenge in relation to Doncaster, because we had a LADO system that in a sense was colluding with the provider, and a LADO system that really wasn't working. And I think we were really we must praise Doncaster. This was a really difficult position for them, but they were very open across both their local authority and CCG in working with us, and they were very keen to understand. And it's one of the things we want to ask you all about, is what should be a stronger role for host authorities in this area, and how do we define that across the piece? Susan, back to you.
You're on mute, Susan.
I thought I'd got myself really well organised to press the mute, unmute at exactly the right time, but I think there must have been some delay. I think it's fair to say that the focus of phase 1 was actually looking at what happened to the children and to start to think about why it went wrong. And when we moved into phase 2, the emphasis was very much starting to look at the system issues and starting to think about, well, what needs to be in place? What can we learn from our analysis of the children's experience and what went wrong, in order to think about what are the issues that need to be addressed, the systemic issues that need to be addressed in order to prevent abuse, in this case, in such cases happening again. That thesis that if we can predict it, then we can prevent it. So this led us to our lines of inquiry for phase 2. What needs to happen to make sure that the voices of children are listened to and heard, and that their rights are respected and upheld? What are the roles of the professionals in keeping children with the most complex needs safe? Particularly in our current context, we know that children with complex health needs and disabilities are dispersed to various settings around the country. What are the conditions for effective and efficient commissioning, so that these children can enjoy the very best support to meet their needs in a timely way? And we undertook a range of seminars and workshops, roundtables, where we had a large number of people from different sectors. And I'm looking down the list of attendees to today's meeting. A number of people on that list came to those roundtables. So again, thank you for that, coming to those roundtables, and thank you for being here today. So it's about drawing in the evidence from what happened at these 3 settings, what we know from research and local practice, and testing our propositions through that structured engagement. Now, one of the constraints with our review is that there was a live criminal investigation ongoing throughout the period of our review. So we weren't able to meet with any of the children nor their parents, but we did speak to parents who had experience, whose children were in similar settings as part of those roundtables. And our report sets out a case for change for the quality, oversight and regulation of residential settings. But we don't think that's enough. We think actually what we want to do is to change the discourse for these children. So at the moment, it feels like residential provision is the default. And we want to make sure that there are choices for parents and children, things, ways in which their needs can be met in a far more dynamic and a far more diverse ways, in order to make sure that their needs are being met. So Christine is now going to hand back to Christine, and she's going to talk to us about the findings from our phase 2 review. Over to you, Christine.
Thank you, Susan. And absolutely right, this idea of changing the discourse. So our findings were really clear that children's voices were not heard and that needs were poorly understood. If you think this reflects what came out of phase 1, that was tested against a much broader piece, and as Susan said, with a whole range of stakeholders. So we looked at, if children's voices aren't heard and their needs aren't understood, and we are failing in our regulatory system, what should we recommend and what should we look at? So there were some keys within that The other thing that was different about phase 2 was that in phase 1 we were not working with provider agencies. By phase 2 we brought providers in, and I think that was really important because actually it was about the fact that there are good providers within the system and we wanted to learn from those. But we wanted to be clear that providers of children's homes have a responsibility to keep their residents safe. And while that sounds obvious, in this case it wasn't working. So what would it be? What were the things we could do to ensure that that was the case and build accountability in? And we worked with a number of providers looking at how best to provide a better framework for that. We've had a number of providers since, as we were working with them, who have now quality assured their own internal frameworks against a Hesley type situation. So how do we understand and what do we do that? The other thing that was key in our findings were that there is now no one agency that can meet these children's needs. And it's really good on the call today to see how many of you come from a range of agencies and positions. So we wanted to understand how best to create a stronger shared ownership of this group of children. They are not health, they are not education, they are not care. They are a combined group of children who need that single, united support around that. So how do we do that, both locally and at government departments? We had children falling between and through the agencies. And it's worth remembering that these are a group of children that ended up in a 52-week residential unit, but some of these children had also been in Tier 4 mental health services, and some of these children would be in secure children's homes. So it's understanding that mix of children and where their needs are. Obviously, throughout the time we were running the review, the world was changing around us, as it has a habit of doing. And so what we were also trying to look at was to make sure that the implementation of the Children's Social Care Review, the improvement plan for SEND, and the changing nature of health in relation to ICBs could be used as opportunities in relation to take this work forward. And so we have been looking and asking government departments to develop statutory guidance which brings these agencies together to jointly commission safe, sufficient and appropriate. The evidence from phase 1, as Susan said, was over half of these children should never have gone into a 52-week placement. So how do we understand that? The key thing as well, and you won't be surprised, was about workforce. We have a major workforce problem across the piece, and it was one of the things we'd asked Ofsted to look at under urgent actions. If we're going to value children, we need to value those people who work with them. And so what we want government to look at is a strategy of the children's workforce in residential settings. And so those are the things at this stage we have asked, and we have been really clear in everything that we've done, that unless these planks of the report are taken forward, we cannot guarantee safety. Sorry, Susan.
Okay, thanks very much indeed, Christy. You will hopefully have had the opportunity to read the report, and what we have done is come up with 9 recommendations, and we think the panel and the NCB and all the bodies that we've worked with, there is that consensus that what we are putting forward, we agree that this is what we should be doing. So you'll see that the recommendations, and I'm not going to sort of read them all out, but I'm just going to talk about each one. The first one is about making sure that these children have a voice. It's really important that they are able to say what they want to happen to them, and that we should expect them to have a view on what they want to happen to them, and that we make it possible for them to do so. But you know, clearly when we're talking about children with these complex health needs and disabilities, many of whom are non-verbal, it takes particular skills to be able to do that, to gain the trust of the young person, to be able to hear their voice and to be able to communicate on their behalf. We want to make sure that parents have a better understanding about how their child's needs can be met. So let's make sure that they get some independent advice about what's being planned for their child. and that there should be some statutory guidance developed in order that we can commission safe, sufficient and appropriate provision for children. So we need to use this as an opportunity to look across the landscape and say, right, you know, what do we have at the moment and what do we need in order to be able to deliver a mixed economy, a wider range of opportunities for these children. But you know, we need that kind of status report which enables us to say what we have now and what we're going to need in the future. And in order to follow on from that, then we need that support for local authorities and ICBs to how they can forecast, how they can procure, and how they start to shape the market. And making sure, and we think that one of the ways in which we can do that is to have some local and sub-regional initiatives so that can look at not only the range of provision, but also the quality of provision in a community-based system. And moving on, commissioning the development of an integrated strategy for the workforce so that we are recruiting, retaining and developing the right people. There is no question this is incredibly challenging work, and what we need is people who have the skills and attributes and are developed so that they can enjoy the rich careers in these settings and be the leaders and managers of the future. We need there to be investment by the providers to in this leadership and workforce development. And as Christine and Annie said, we met with some really great providers and we're looking to them to help us to shape that. We need to make sure that the systems for the identification of risks are strengthened for the host local authority. At the moment, they don't always know if there are concerns which are being raised where they've placed a particular child. And importantly, and finally, the Department for Education and DHSC should review and revise the regulatory framework for these settings and to establish arrangements for joint inspections by Ofsted and CQC, because what we need is a robust framework which enables these settings to be inspected under the education, health and care. So it's bringing the three elements together in the regulatory and inspection system. And we think that's a really fundamental shift in terms of the way in which those bodies regulate and inspect these settings, and they do that in a joint and coordinated way. So those are our recommendations. We're now going to go into some the opportunity for some discussion. We're slightly ahead of time, but that's no bad thing. It'll give us a bit of a time to make sure that we're properly organised, and I'll hand over to Steve to comment on that in just a moment. So we've got 3 questions that we're going to ask you to look at about what does the report findings mean for your practice? What might be the challenges be and how you're going to tackle those? Commissioning, how you, as a local area, how you're going to commission children with disabilities, but the services for these children, and how will you make sure that with other agencies you know what's happening to children placed in residential settings, taking action when needed. So those are the 3 questions. We've, you know, these are really big questions. We've got until 10 past 10, so we've got a good amount of time in order to really get to grips with these questions, but they are huge questions, so we've got a cunning plan as to how we can make sure that we cover them all in the right amount of time. So I'll hand over to Steve to take us through the arrangements for this next part of our webinar.
Thank you,
Thanks,
Susan,
Steve.
and thank you, Christine. So just before we go there's just 1 or 2 questions and perhaps some very useful comments that have been made in the forum. Excuse me. The first one is about just a question really about logistics, the reliability of the DCS. the question is, I wonder how reliable you felt the DCS responses were. For some of the RSS CHSs I work with, there is no LADO, or LADO referrals are filtered through the front door first. Front door often has no experience or understanding of children with disabilities and complex needs, statutory guidance, regulation in residential schools and children's homes. Is that a reflection that you recognise?
Do you want to come in there, Christine, and then Annie? Oh, so great, Jenny's on the call. So
Yeah.
Jenny, do you want to take it first, Jenny, as you've led with the work with directors of children's services?
Yeah, absolutely. So first of all, to say that the responses, and we did go through them in detail, and particularly with the expert advice of Christine and her team, we did feel they were robust. We were also felt that that they actually moved on people's thinking and approach to quality assurance. Many of those visits were done with health commissioning colleagues, and as you can see through the report, there's a very strong theme of local authorities and ICBs commissioners working together. Bit concerned to hear that there's an understanding that some local authorities don't have local authority designated officers. That's certainly not my experience. You know, this is set out in regulation as statutory duty. So, but the resource might vary from local authority to local authority. And certainly in our discussions before this report was made, you know, local areas did realise that they may well have to invest in more resource to their local authority designated officer teams. So that point is well made. And if certainly whoever put that question in, I would certainly make sure that you investigate and contact your local authority. You could do that through your safeguarding partnership as well. And in terms of expertise, there's very clear guidelines, or should be, about how local authority designated officers look at all referrals that come in. So if you do have concerns, do go to your local authority, and I would suggest go to your safeguarding partnership as well, because one of the recommendations that we've made is that safeguarding partnerships have an overview of how local areas implement recommendations which are for local areas rather than national government. Thank you.
Thank you. Let's just pick up on one or two of the other comments. Just quite rightly, somebody's saying, can we not use acronyms, please? So DCS, Director of Children's Services, and so on. Any acronyms that you find in there, just put a comment in saying, I don't know what that is. It's all anonymous, so we will spare any blushes. But yes, it would be good to speak a more generic language around some of these terms and so on. So just a couple of points. A point about LADO right at the bottom there, 13. There is a recognition of the need to be clearer about expectations about role of LADO, and therefore work will be progressed at a national level. See also recommendations. So that's another response from the panel.
Yes.
There are a number of local authorities who do not have a LADO or LADO team, including one that has done away with the role since you published phase 1. So be interested to know a little bit more about that. So again, the author might just add a bit of explanation to that. You can click on that comment and it comes up with respond, so you can reply directly to that. So let's just pick up on a couple of other things. There's a conversation about children's voice, and comment number 6. Many of these children are not fluent. You did make this point, I think, Susan. So many of these children are not fluent with the language. Their behaviour and verbalisation indicates their distress. How do we understand this at an individual level? And then a response to that saying there are some really good tools and approaches, number 7, for working with non-verbal children, either in terms of the use of sign and symbols and so on. So perhaps, you know, quick comment about how you really engage, because you're talking about that communication and building trust and having their voice and requirements included in the discussion.
Do you want to come to that on that, Christine?
Yeah, and mine was the response, Steve, not surprisingly. So all of the children who were placed and children like them will have a communication process if we can find it. It's not the responsibility of children, it's the responsibility of the professionals who work with them. So lots and lots of these children would have used basic symbol systems like PECS, which stands for Picture Exchange Communication System. It enables children to have their needs met. One of the problems we had in the Hesley group was those systems were taken away from children. Lots and lots of children use basic sign language, and even for children who have apparently no communication, there's been a lot of work done, and we can find some good examples for people of communication passports, which are really understanding children and how they use their body language and how they use any verbalizations, so that we can be really clear about how children are happy or distressed or whatever. So for each child who is placed within a system like this, we would expect, as part of the placing process, that a communication passport, a communication plan would accompany those child, and we would then expect that provider to use that plan, which is why in the quality and safety reviews that we asked you to do, we asked you to look specifically at children's communication and the support. If people want to know more about good communication plans and whatever, then please go on to the CDC website, where we have lots of this. But our absolute firm belief is there is not a child that does not communicate.
Thank you. Let's just move on to the couple of comments or the discussion that's going on the forum about education and EHC plans, so education, health and care. Question number 8 talks about, oh, sorry, we covered that. Yeah, are there enough experts from education involved? All these children were probably on EHC plans. And another comment below, which is about, oh, I can't see it at the moment, sorry. Yeah, so over the many years, there have been numerous calls for education, care and health to join up, which have had little impact, if any. What will be different this time? I guess what's the, you know, the additional step we can take this time?
I think and I've responded to that one. I think the big thing is that Ofsted and CQC have agreed that they should do it together. And I think that's the big step forward, and that's something that we're really pleased about. And also, when we've had our discussions with Ofsted, they've talked about the need to have a framework for the inspection of these settings, which does bring together the education and health and care. Because I think, you know, what was happening is that the school was being inspected under one framework, the care was being inspected under another, and the health was being inspected under another. And it's how all of those things were brought together. So, you know, clearly there's a lot of work to do to make sure that the care inspection isn't just a kind of, you know, ticking boxes to about, you know, does this exist, but actually looks qualitatively at the provision, and as the question indicates, integrates it together, and to make sure that it's considered as in the round. So I think, you know, there's a lot of work to do to make sure that we've got something which is fit for purpose, but the fact that we have that commitment to work together, I think represents a good way forward.
Yeah. And Susan, I'll come to you in a minute, Annie. Susan, you also mentioned in the presentation about the requirement for government departments to be more joined up as well. Do you want to make a quick comment about how you see that happening going forward?
Well, yes, I mean, that's something which is really, really important. And we, Annie and I, met with a cross-ministerial group yesterday, and we were making exactly that point. We need the government departments to integrate their thinking, so that, you know, you haven't got the Home Office saying, well, we need it in that sense, Ministry of Justice saying we need it in another, health and social care in one sense, and DfE thinking in another way. And I think, you know, where Annie is leading on that interministerial interface, then I think then, you know, none of the ministers that were at that meeting disagreed with our thesis.
Great, and I'll come to you, Annie, but just also remind people that they are very welcome just to put their hand up in MS Teams and come off mute and ask a verbal question. And also thank you for the quite distinct debate that's going on. I'll pick up on one or two of those comments in a minute, but Annie?
I mean, yeah, I just wanted to kind of, build on what Susan's saying, because this is a very important aspect. And in the panel and with Christine and with stakeholders, we've reflected a lot on that kind of the fragmentation that can often occur between the sort of education schools, health systems and local authority children's social care systems. And Susan's, really right to sort of emphasise how the message from the panel to government has been about you need to join up. And of course, even within DFE, it is about joining up the bits, the kind of elements, the teams who are working on special educational needs with those who are working on the children's social care reform. So that's, even within departments, it's important to do that join up. But two additional recommendations in the report, I think, speak to this aspect of the agenda. One is around commissioning, and we talk about being much more joined up in the commissioning of placements, and that's commissioning but within local authorities. And of course, within children's services, you have the educational sort of side of things, and you have the children's social care. So local authorities should be integrated together and with the integrated care boards in terms of the knowing what the needs are of the children with disabilities and complex health needs in their local areas, and then commissioning that the provision and support that is needed. And part of that, we say in one of the recommendations, is about commissioning support and education closer to home, because we saw, I think, with quite a number of the children placed at Hesley, that a lot of them could have been placed, as you've heard, could have been placed in much more locally. So that whole commissioning sort of work is really important in terms of getting that integrated approach across education and involving schools in that education, local and health. And we will pick that up in the small group discussion, I'm sure.
Excellent. Thank you, Annie. Not seeing any hands up, so just back to the forum. There's a number of interesting responses and comments. There's of course the funding issue, and that's caused a number of responses. So better services cost more money. Comment 24. LAs are under huge financial pressure and have been for over a generation. I would love more LADOs and social workers, but no money to pay for. And some of the obscene level of profit that Helsey were making should have found its way to Doncaster to fund oversight, etc. This is about regional care cooperatives. Does the panel feel that the development of regional care cooperatives will support improved homes for our children with complex needs and disabilities? And some responses there. Perhaps you can pick up on that. I saw one about number 33, a combined authority police funded LADO office, ? Both are so intrinsically linked. Currently, there is an authority function, but could be considered as a partnership function. I'm not sure a lack of money can be a reasonable position to take, as it is vital safeguarding function that can be overlooked. So perhaps a comment on what those two things. So the combined authority LADO office and the regional coordinated health.
We did, Steve, as part of the phase 2 investigations, we did work with a local authority where the LADO was embedded in the police. So we have seen that model in practice, and Susan and I spent a very useful 2 hours with that particular authority and the police, understanding the benefits of that. And there were certainly some benefits to it. And a really strong relationship. But again, you would want to know that wherever the LADO was based, the partnerships across the piece were working, so including the police and the local authorities. So you weren't in effect creating a different sort of silo. But I think one of the really interesting points of learning for me as we move through the review was the very different places that LADOs were in, the very different expectations that were on them, the very different processes. Now, as we were going through, the DFE had already said that it wanted to update and look again at the LADO handbook. And I think there is some significant learning from certainly our experiences and others about LADOs, their place and the partnerships that they're in.
Excellent. Thank you. Jenny, quick response on that?
Yes, certainly there's some really good ideas in the chat around Lado, including some work that's been done by a Safeguarding Partnership, and hence the recommendation which the DFE have picked up to really review the role of the Lado, the regulations around it, and any review brings in consultation as well. So I would urge people, it's a good time to review things, and some of those ideas in the chat and what Christine had just saying would be really good to look at. On regional commissioning, it's fair to say that there's been no pathways. It's in the implementation plan. The key thing that's come out of this review, and picking up what Annie said, is that these children need integrated commissioning. This is not just one agency, and it really needs to drive forward. It was said in the 2014 reforms, it really hasn't taken off, and a real opportunity we felt to really push that in this review. Maybe regional care cooperatives will push that forward, but essentially it needs to be integrated commissioning and not just one agency.
Thank you, Jenny, and thank you, Christine. So again, the forum is also an opportunity for you to share any good practice or things that are emerging within your partnership that are perhaps having some good early results. We've got a huge number of agencies represented today, but I just wanted to mention comment 35, specifically from a police point of view. The process of knowing who to report our concerns to and via what route have always been a stumbling point. Officers will submit protection notices, which are shared with social care Lado, but there are no guarantees that further referrals would be made, and rarely do we get updates on what's happened after our referral. So a little communication lump there. And actually, I just picked up on another comment, which is that in my experience, Lados who are or have been serving police officers tend to be excellent. Long-serving police officers develop a fine-tuned sense of knowing, seeing, and stopping abuse. So interested on your feedback on that as well. So again, just final chance to put your hand up in the Teams and make any verbal contribution here. Continue with the forum as well, and just wanted to see if any of the panel wanted to pick up on any final comments in this Q&A on the presentation, because we're going to go into those 3 questions for discussion very shortly in breakouts. Okay, good. So the process now is that you're going to be automatically put into groups, and there are 3 topics we're encouraging you to discuss. They are now appearing in the forum for the 114 people in there, and you will also have a host in your breakout, so somebody who will just gently begin to start the conversation. We're hoping that in this smaller group you get more chance to discuss what your specific perspectives are, and perhaps share some of your good practice and things perhaps that can be improved that you're working on. So the 3 blocks there, the green, the orange and the blue, talk about practice, commissioning and oversight and quality assurance. When you click enter, you'll see the prompt that came from the slides from the panel, and they're particularly interested in your views around practice. What does the report findings mean for your practice? So that's the so what question, and what might the challenges be to tackle that? The commissioning issue is all about how should the way our local area commissions services for children and with disabilities change to better meet the needs and keep them safe. So your chance to contribute to that how to question. And finally, the quality and oversight, so oversight and quality assurance. How will you make sure that with other agencies, what is happening to children placed in residential settings, taking action when needed? So your hosts are going to encourage each of the groups to start at a slightly different point. And I'm expecting you to perhaps have a discussion during the 20-minute breakouts in detail on at least 2 of those. And if you can make any comments about the one that you perhaps don't get to quite so fully, then please use the forum to do that, and capture the main conclusions and the points that you feel are relevant for other people to hear, so that we have this smaller, more dynamic conversation now, but you're capturing any insights or good practice or emerging practice in the forum for the benefit of everybody else. And we'll come back in 20 minutes and have a discussion about some of the highlights and some of the insights that you perhaps revealed during those breakout discussions. And just checking with Amina that we're ready to go. And so we'll see you back in 20 minutes. And please actively discuss. Don't let anybody dominate the conversations, and make sure your points are made and captured in the forum. And we'll see you back here in 20 minutes. Amina.
Right.
Yeah, and we need to get better at that. There's a couple of comments that, of course, reflect the discussion we had about money and value. Not all providers are mercenary. So somebody said providers are mercenary is not a fair comment. Many of the providers nationally are charities and therefore non-profit making. So I'm sure you'll have a view on that. And just let me quickly talk about what was captured in the commissioning discussions for those of you who got to that. Children's vulnerability should not be defined by the nature of the institution, i.e. hospital or residential school, but by communication, visibility, distance from home, 52-week placement. So that's firmly putting the voice of the child at the centre, or the needs of the child. The relationship between operational teams and commissioning is integral. Commissioning colleagues often have a wealth of knowledge and power in terms of scrutiny of placements, including commissioning of the completion of the quality framework is key. So open floor now. We have some hands up. Thank you for that. I'm going to come to just find out who that is. Vijay. Hello, Vijay.
Hi, I can unmute myself. I am Vijay Patel. I work in the NHS. My point is about regulation, because there's a block for local authority and ICBs being able to go in together to look at a care home, and they can do it for a child in place, but it can't for others. And that's the real issue in terms of being able to go in together and see what is quality care across the piece. And I've had a lot of, again, in a previous job, I had an issue around mental health. We want to do it, couldn't do it. We didn't have the regulation to allow us. So there's something about that, and having regulation to allow the local authority and the ICS to go in together to look at the whole care of every child placed there, not just the ones they placed.
Excellent. A couple of nods there around the panel. Do you want to make a quick response to that, and then I'll come to Colin?
Yes, Sally, are you the best placed to comment on that?
Yes, thanks, Susan.
Thanks, Sally.
It's a really good point that you make there, Vijay. I think what the recommendations are advocating is that the ICB and local authority do have that strengthened role in going into providers across their geographical footprint. Hopefully the ICB legislation and the exec accountability now for SEND children and safeguarding will help to enable that. So just aware that ICBs have only just got established in the last 9 months, but expecting governance systems to start to enable that multi-agency overview to take place now.
Thank you, Sally. Colin Pettigrew, your question.
Yeah, Colin Pettigrew, Corporate Director for Children's Services in Nottinghamshire County Council. Yeah, and I'll caveat what I'm about to say by saying I'm as guilty of doing this as anyone else. Yeah, so I'm not going to take a moral high ground bit about it. But all of us, certainly most of us, if not all of us in this call, are part of this system somewhere. And I think Annie reminded us at the beginning that this was a systems failure. Yeah, not a failure of Ofsted or a failure of Doncaster MBC or a failure of Hesley Hall or a failure of the parents or a failure of local authority placement. It was an absolute systems failure. Yeah. And until each of us look really strongly in the mirror about the part that we play in that system, and look across the system to engage in a conversation with our colleagues, whether that's in commissioning and health, commissioning in the local authority, Ofsted, whatever, we're not going to make a big impact upon this, because we will just say, if only Ofsted had done this, or if only someone else had done that, or if only. And it's going to have to be a systems approach, because if it isn't, yeah, we'll just go back to saying the problem at Winterbourne was young adults in a hospital 52 weeks a year, and we won't get that learning for children, yeah, 52 weeks in a school. Yeah,
Right.
as I say, I'm as guilty as anyone, Steve, for doing that.
Yeah, thank you, Colin. That kind of you know, transparency and honesty, I think, is you know, one of the component parts around that, in order that people are in the right frame of mind to really look through at the process and the system and to where the gaps are. Okay, so perhaps no more specific questions. So I'm just going to invite people to reflect on the one or two topics they discussed, and just going to quality and oversight, or oversight and quality first. What were the insights or key points? What did you learn from it? I'm of course going to ask the panel this, but I'm just interested if anybody else wants to kind of raise an issue or a point that they took away from their breakout discussion. Any general comments and so on? Just to keep it to oversight and quality at the moment. Thank you, Nancy.
Have anyone that was leading the group, so we just did it ourselves, as you would. I think it's already been said before that the real difficulty for a lot of us is that actually we don't have any authority to go into a home. And I know what you've just said about ICBs. I work with one. We're not at that point yet. So all the time that we're not at that point, we've got children potentially not getting the care that they need to improve their outcomes. So although we in Kent, who have hundreds of children's homes, have tried desperately to go in and support each children's home, lots of the big providers are saying, no, we don't want you anywhere near us. You've got no authority. So from a health point of view, we can't do that. So that is a real blocker that we talked about in our group. And notification, and that's a serious issue. So if we don't know children are placed with us, how can we ensure better outcomes for them? How can we ensure from a health point of view we have got enough capacity within our services and the right services to meet the needs of those children with complex health needs? I think that is a real problem, and notification has been an issue for years, as long as I've worked with looked after children, and it's no better. So, you know, that is always going to stand in our way of ensuring the welfare of our children. Yeah,
thank you, Nancy. Susan, your hand went up about the same time. I don't know whether you got a response to that or another comment.
That it's simply to report back on the comments, and thanks to all the colleagues who made those remarks. And I think a couple of things I took away from that. One is about the fact the quality and safety review, which colleagues undertook at the end of last year, seems to have been a really good opportunity to look at the provision. And colleagues were talking about that they intend to build that into their processes going forward. So that really pleased to hear about that. Lots of discussion about the LADO and the role of the LADO, and whether there's a need in working together to give greater clarity about the expectations of the LADO. And the panel has been consulted by DfE on working together, and so we'll take that away and think critically about what we can make sure goes in there. And that comment that Nancy made about notification, it's not always clear. Colleagues in local authorities don't always know about new settings opening up. You know, one of our colleagues described it, and there's like pop-ups. You don't know that it's happening. You don't know if a child has been placed there. The day you find out is when it goes wrong, and we need to think really carefully about how we can make sure that people are properly informed, because it also builds on Nancy's point about you know, lines of accountability and authority to act as well.
Great, thank you, Susan. So if this is triggering any kind of thought or insight, please again capture it in the forum. The panel do look at the forum report in great detail to pick up on the little nuggets and insights. So I saw a couple of hands going up. Jenny, I'm going to come to you next. Jenny Coles.
Take away from the. Can you hear me?
Yeah,
oh, yeah.
we can.
Yeah, perfect. Yeah. Sorry. I don't want to take away from other participants, but we had somebody, a Lado, who sits on the National Forum of Lados, and was very keen to put in that relationship between the host and the placing authority, but also how the challenges for Lados in terms of monitoring concerns because of recording systems and having to use individual children's recording systems. So that's an area that they, as a group, are flagging, and they're also very aware of that consistency issue as well. So we'll be keen to feed in, and I'll take that back as well. Thank you.
Yeah, great. Thank you, Jenny. Sally.
Thanks, Steve. I just wanted to thank Nancy for her comments, and I may come back to her for some more information on that. But in our group, we talked about the culture of regulation, and that we're not at a place where everybody wants to do the best thing for children. People act on the back of being inspected or having visits from different organisations. And that is taken away from the purpose of quality improvement and making sure that everybody's got the child's emotional well-being at heart. And also it can make people quite defensive. So you're not really getting the best out of an organisation. So I just thought that was an interesting point to feed in.
Yeah, thank you, Sally. And some really great contributions now, particularly in the practice forum. Some additions since we've been in this whole group session. Talking about training and development of care staff, emphasis on how important pupil voice is in getting to the heart of the issue. There's something about the reiteration of the point that we made earlier about making sure that non-verbal children are included, and best efforts made there. The role of Learning Disability and Autism Programme, another acronym, LDAP. Key workers in our local area have been making positive contribution in supporting the team supporting young people, and ensure that they are working well to hear young people's voice. So yeah, lots of great examples of how to overcome that. I know people are ready to leave. We've got a few minutes left. I'm just going to hand back to the panel in a moment, but just to say, if you feel this has been of value and there are colleagues within your partnership and local area who might benefit from this, we are rerunning this virtually the same in terms of the topics on Tuesday, the 2nd of May. So next week after the bank holiday, but it will start at 9:30, not 9 o'clock as today, and run on till 11 o'clock. So let your colleagues know that their voice can also be represented in response to the report from phase 2. So a couple of minutes left. Just any final thoughts from the panel, and then we'll hand back to Annie to close us out. What have you picked up today? Mark, actually, let's just hear from Mark first. You've just put your hand up. Just let us know who you are, Mark, and where you sit.
No, that's fine. I'm Detective Sergeant Murphy from Nottinghamshire Police, currently working on the missing persons unit. Just something obviously I pass down to our officers constantly is about professional curiosity.
Yeah.
Don't be afraid to dig a little bit deeper. You know, there is literally no harm in digging a little bit deeper, spending a couple more minutes with the people you sat with, asking a few more probing questions, build your rapport, build your trust with them. And if you have the slightest suspicion of safeguarding issues, report it. Know it, see it, stop it is what we roll with here.
Thank you, Mark. And yeah, I think in 15 years of supporting learning reviews and safeguarding learning reviews, that is absolutely always one of the key outcomes, is that, you know, if only there had been slightly more professional curiosity at particular points, other things may be picked up. Thanks for making that point, Mark. Good. Okay, a couple of minutes left. Any quick final thoughts from the panel? And then Annie, perhaps you can close us out.
Just from me, Steve, it was really, really helpful to have staff in my breakout room who worked on safeguarding partnerships. And we're really clear about taking the panel's report locally and using their ability to bring partners together to understand how this was going to work in their area. I found it a really positive experience.
Great. Thank you very much, Christine. Just to say, the forum will be open for a few days, and certainly we'll then repeat this process, as I said, on Tuesday next week. So when you think about the comment that you should have made in the next few days, please just click that link again. It's in the invite and you'll get access to be able to contribute it. Peter.
Yeah, just from my group, we were privileged to have a healthcare assistant working in a residential unit, and just reminded me just how wonderful the staff that we've got working in this area are, and how much we should value and support them.
Right,
So
thank you, Peter. Good. Okay, I think we're just about out of time. So Annie, do you want to close us out?
Better come off mute. Yes, well, thank you everybody for some really rich reflections and discussion this morning. I think it's been, you know, we will have taken away a lot of your thinking, your ideas, your experiences and reflections. And I suppose, I think, you know, for me, what's really come through is that sense of collective responsibility. We've all got a role to play, whether we're, you know, working in strategic roles or operational roles, regulatory roles, and that kind of eyes and ears on this group of children is so important, and really gratified really by the kind of response and the ways in which people are going to take forward the findings, the recommendations in their own local areas, with whether it's in their safeguarding partnerships or in their own individual agencies. So thank you very much indeed. You know, that's given us a lot more fuel for thought, because one of the things we should perhaps really emphasize is, though we have now landed the recommendations, the 9 recommendations with government, and we'll get a response within 6 months, that's what we expect, we will make sure, because we're a standing panel, that those recommendations are taken forward and are not just kind of left to gather dust, which is too often the case with sort of inquiries and reviews like this. So thank you everybody, and hope the rest of the day goes well.
Great. Thank you very much, Annie. Thanks. Goodbye. There is the link to the evaluation from this, which Amina will also circulate by email. Don't forget the forum is open for the next few days for your further insights.